Good evening. Good evening. I'm Dr. Vanya. I'm one of the children's doctor here. I believe I'm speaking to Sarah's mom.
Yes, good evening, doctor. Yeah, I'm Sarah's mom.
Thank you for coming in today, mom. Are you aware of our today's agenda?
No, doctor, my child is sick. I'm here to just discuss regarding my child's condition.
Okay. So I would be asking you some questions regarding Sarah's health and would be taking down some notes. Is it okay for you?
Yeah, sure.
So, mom, can you tell me what brings you here today?
Doctor, I'm tired of, I don't know what's going on for her. She has been repeatedly getting sick for the last 3 to 4 months, and I'm really concerned about her now. So that's the main issue.
I'm sorry to hear that. I can understand it must be tough for you. So, can you describe more about the problem that Sarah is facing?
Doctor, actually, I don't know. She is having a lots of coughing bouts as well. She is coughing a lot, and sometimes she has, I feel like, a breathing difficulty as well. And sometimes she spits everything. She also is developing fever at times. So there are two, three issues that I'm thinking they are getting worse day by day.
I'm sorry to hear that. So, this cough, was it sudden in onset or did it start gradually?
Initially, I think it was less in intensity and it was mild. But now, for the past 2 months, it's been constant. It's been more severe.
I'm sorry to hear that. And what makes it worse or makes it better?
I can't say about it, doctor, what's making it worse, but better sometimes I put her because the doctors advise sometimes the nebulizations, and she has tried multiple nebulizations and sometimes the antibiotics as well. So temporarily she gets better, and then again she develops it like I don't know why she's so prone to them.
I can understand it must be very worrying for you. So, these coughs, they are also of same intensity. Do they have any phlegm with them?
Doctor, I feel like sometimes when she's coughing, I feel like, or maybe sometime when I just given nebulization, that her chest is like bit full and phlegm is there, but she didn't spits out.
I'm sorry to hear that. Can you describe more about this phlegm, the color, how thick it is?
I think it's very thick and it's for her. She gets like a difficult to take it out, but I feel like it's congested and sometimes it depends. She's not able. She's I think still small, but sometimes when she vomits, I see that the greenish yellow color as well. That's what I was like. I don't know, thick sputum like thing was there.
I can understand how what Sarah must be going through. So this cough, is it more at the night or the day or same intensity?
Doctor, actually, sometimes I think in the nighttime her symptoms are worse, but definitely some episodes happens during the day as well.
Okay. Does she also have some musical sounds with it?
Sometimes I can say, but not always. Sometimes happen.
Okay. Does physical activity, exercise, or pets make it worse?
Um, I think doctor, she's been sick lately, and that's why she's not that much active now. I'm so worried about that as well. And we don't have pets at home actually.
Okay. Mom, you have also told me that she's been having fever. So, can you describe that fever?
Yes, whenever she gets sick, initially it starts with some kind of a coughing, and later on, sometimes she had a high fever, and the doctor prescribed antibiotic as well. So I think two courses, 3 courses of antibiotic she took in the last 2 months, and that happened, and it's associated that she developed some chest infection, maybe high fever develops, and that is what I have observed, but not always.
So, this fever is continuous throughout the day?
Yes, doctor. Mostly it's continuous. Initially, it starts with the low grade, and then I don't know. Then the doctor advises to keep on like the nebulizations and the basic things. But then suddenly it shoots up, and she has sometimes a breathing difficulty as well. So she had been on antibiotics for 3 times in the last 2 months.
I'm sorry to hear that. Also, mom, you have told about fast breathing. So, can you describe more about that?
Yeah, sometimes when she's sick, I feel like that her cough is so severe, and when her fever is touching high. So I feel like because the doctors told me about these are the red flag signs I have to be careful about. So I feel like that she has very fast breathing and she's very sleepy because they told us like you have to report to the emergency if these things happen. So that's happened. But then she's like gets some nebulizations and then some antibiotic and she gets better.
Okay. Has she ever turned bluish in color?
No, doctor.
Okay. Any concerns for her weight previously in?
Yeah, doctor. She's not, I think her weight is drastically coming down. She was average before as well. So I think now she's underweight now.
I'm sorry to hear that. How is the appetite and the sleep pattern?
No, hepatitis like, yeah, less because most of the time she's been sick or suffering from this cough and cold. So her appetite has been really down. Regarding the sleep as well, I got scared when she's sick at that time at night. She has more bouts of coughing and she wakes up from sleep.
I'm sorry to hear that. Has she also been experiencing some runny nose or watering of the eyes?
No, but sometimes it happened, but usually it's not there. Usually she has a bad cough and then fever and then this thing. Yeah.
Okay. So, can you describe her pee for me?
Yeah, that's normal. I didn't feel like there is any concern about it.
Okay. Any concerns for her poo?
Yeah, doctor, maybe I'm noticing that she's been passing frequently for the past 2 to 3 months, maybe.
Okay. So, how soft it is? Is it normal formed stool?
No, sometimes it's kind of a lose and she's passing like 3 to 4 times. So I was thinking maybe she's having antibiotic, that's why. But even she's not on antibiotic, she's sometimes passing 4 to 5 times as well. So often on she's complains of this problem as well.
I'm sorry to hear that. Are they also sticky and difficult to wash?
Usually I think she's told I haven't noticed, but maybe, but I'm not sure about it.
Okay. So does she also have vomiting after the coughing?
Not always. When she has a thick phlegm and she is really sick, then sometimes she vomits.
Okay. Has she been experiencing some reddish rash on her skin or some lumps and bumps on her body?
No.
Okay. Any concerns for racing of the heart?
Sometimes I feel like when she's sick, or maybe when we are giving a lot of nebulizations.
Okay. I'm sorry to hear that. Also, any has she complained of pain in her joints?
No.
Any concerns for her vision?
No.
Okay. Also, has she ever complained of some, food coming back into her food passages or cough
No.
worsened by feeding? Okay.
Nothing like that.
So, mom, you have told me that she has been sick for the last 3 to 4 months. Can you tell me when did this all start together? Was she well previously?
Previously, I didn't find like she is something like that. But now I think it's getting, I'm thinking more about it now. Usually they have some childhood allergies or something. So she gets sometimes, but now it's very frequent. That's why, otherwise I would definitely have taken her somewhere if the issue has been earlier.
Yes, mom, I can understand. So, can you tell me, has Sarah been hospitalized ever?
Mm, no, not hospitalized, but for the emergency treatment, sometimes we went.
Okay, and which team of doctors are you following?
Generally, we didn't follow, but I think this is the first time we are referred to the hospital. Before, it was only the GPs that are being used to giving her the treatment and antibiotics.
Okay. Um. What medication has Sarah been taking so far, apart from the
Uh,
nebulizations and antibiotics?
that's it. I don't remember like no specific medications other than this.
Okay. Has she been experiencing any long-standing illness previously?
No.
Okay. Has Sarah undergone any surgery recently?
No.
Okay. So can you describe Sarah's birth for me?
Yeah, doctor, actually, she was born normally and otherwise she was okay. She was born on time and there wasn't any issue before or after birth. My like pregnancy was also smooth, so everything was fine at that time.
That's good to know. Was Sarah hospitalized ever or needed oxygen
No, no, doctor, she was okay. So we were
after birth?
discharged immediately. We were discharged the next day. Everything was fine.
Okay, that's good. Did she have the newborn screening test?
No, doctor. Actually, we didn't get to that because, it was not covered by my insurance. And she was okay. I didn't felt the need that we need to get it done.
Mm-hmm. Also, did she pass her first poo within the first 2 days?
I don't remember when she passed, but if there was an issue, I must be remembering that.
Yes, mom. Also, afterwards, when Sarah was discharged, she remained well. She did not have any similar illnesses.
No.
Okay, that's good to know. Has she received all her jabs?
Yes.
Okay. Also, has she received any additional jab?
No, doctor.
Okay. Can you describe her diet for me?
Yeah, she's a picky eater and very difficult to convince her. Generally speaking, definitely she loves rice, so mostly she's taking whatever is being made at home. No specific diet. She just takes everything that's being cooked at home.
Okay, that's good to know. Also, mom, you told that she's losing weight. So, were there any concerns from the GP as well?
Just a second. Uh, yes, actually, we started following her. So I think recently when we get her checkup done, so they told like her weight is a problem. So maybe they will put us for a consultation with a dietitian as well. But this is the first time they informed us. Previously, because because of her ill health, we were thinking maybe she will grow up and she will gain once she's better. But now she needs. So I think the GP also said like maybe we need to check with the dietitian. He's gonna refer us to that.
Okay, has the GP advised you any capsules to be taken with the food?
No, doctor, no.
Okay. How is Sarah's development? Is she walking and running like the other kids?
Oh, yeah, I think she's otherwise fine and she's good as well. She's walking, running, jumping. But when she's sick, she doesn't want. I know nowadays she's not that much interested in play and she's getting more sickness. That's why.
I'm sorry to hear that. So, mom, can you describe your family for me?
Yeah, so actually, Sarah is the youngest one, and I have one other kid, and me, my husband.
Okay. Any long-standing similar illness in your family like Sarah's experiencing?
I think, yeah, the father's been allergic too, and he's a problem for that allergies, sinusitis and nasal allergies. That's it. Otherwise, I don't think so. My other child is well and doing fine, no issues with them.
Okay. Also, any travel from some um, TB endemic area recently?
TB, what is TB, doctor?
Any long-standing, any sick relative who might have visited you?
No, no, doctor, no, nothing. I'm not aware of like that.
Okay. Can you describe your home environment for me?
Yeah, so we are living in a two-bedroom house, and I think that's adequate for our family. Yeah, so otherwise, I know because of her allergies and these problems, we are taking precautions and we are not keeping any pets at home.
Okay. Anyone smoking in the house?
No, not in my house, doctor.
Okay. Has she started going to the nursery?
No, not yet.
Okay. So how has this impacted you and your family?
Yeah, doctor, actually, me and my husband both are working, so it's getting very difficult for us because, if she's sick overnight, I was unable to go to the work and I'm missing a lot of days as well. So I think that's really difficult. That's why I just wanted to get her checked. And because of her poor health, I'm also worried about it. She's losing weight.
I'm so sorry to hear that. So, mom, what do you and your husband do for a living?
Yeah, my husband works in the bank and I'm also working at a school and I'm a teacher.
Okay, and is your income satisfactory for you?
Yeah, but actually we both have to work because the area which we are living in is very expensive. So I think we both have to work. That's why.
Yes, yes, I can understand. So, do you require any social or financial support for Sarah's health?
Usually the healthcare is free over here, so till now it's not an issue for us. But she's getting quite sick, so I just wanted to get all the tests done and see what's the happening with her.
Yes, yes, I can understand, mom. So, last thing, mom, I wanted to ask, Sarah complained of something coming out from her back passages?
No, doctor.
Okay. So, thank you for your time, mom. I would discuss it with my GP and get back to you.
Okay, okay, sure, sure, doctor. So to summarize your
So
case.
today, I've taken history from Sarah. So today, I've taken history from Sarah's mom, who is experiencing cough for the last 3 to 4 months, gradually increasing in intensity, slightly improved with nebulization and antibiotics, and also it is accompanied by fever, which is continuous, often also improved with the antibiotics. There are concerns for fast breathing and musical sounds with it, accompanied by weight loss, decreased appetite, altered sleep patterns. She is born to. She is the youngest of the family with no similar chronic illness in the family. The disease has significant psychosocial impact on the family in the form of increased expenses and uh, parents having to visit the hospital multiple times for her health.
Mm-hmm.
Okay, so one more, Vanya, can you put up? I think few of the complaints problem list are missing.
Good, you did a good
So give it
effort,
again
just a bit more.
and give it in the same pattern as you described the history. So if there is anything in the family history, anything in the birth history, you have to mention it. Okay.
Yes, ma'am.
Yeah. So give it
Uh,
more try. Yeah, the summary part.
Sorry, ma'am, the voice was breaking. I could not hear.
You repeat your
Summary.
summary from the beginning.
Okay. Today I've taken history from Sarah's mom. Sarah is suffering for cough, which is productive for the last 3 to 4 months, worsening over the last 2 months, improved slightly with nebulizations and antibiotics. It is associated with musical sounds, fever, which is also worsened over the last 2 months, fast breathing, decreased weight, decreased appetite, and there have been she's on follow with the GP with multiple visits to the emergency. She is they live in a good household with no similar chronic illness in the family. The disease has significant psychosocial impact on the family in the form of increased expenses and parents being concerned because of repeated hospital visits.
Okay. So, Vanya, you did very well. It was a very, very good effort. Okay. But in the history, you should not give any information that is not correct. For example, you're saying that it is having a social impact. So the mother is telling you that the government is taking care of the finances, right? So maybe you
Yes,
can
ma'am.
say having a psychological impact, okay, but not social.
Okay.
Okay?
Yes.
What is correct, you have to deliver it in the same way. Similarly, the newborn screening test was not done, right? So
Yes,
that
ma'am.
is why when
Okay.
you're writing, please write just one line like cough, fever, breathing difficulty, weight loss, diarrhea. You did not mention in your problem list,
Yes.
okay?
Yes.
So that all, and then the newborn screening missing, that is important. There is family history of allergies, that is important, okay? And then
Yes, ma'am.
the disease on the child and on the family that you can mention. So now put it again one more time in this way.
Yes. So today I've taken history from Sarah's mother. Sarah is suffering from productive cough for the last 3 to 4 months, worsening over the last 2 months, improved slightly with nebulizations and antibiotics. It is accompanied with musical sounds, high-grade fever for the last 2 months, fast breathing, decreased appetite and weight loss, and palpitations. She is also experiencing loose stools for the last 2 to 3 weeks, sometimes sticky, and not improved with the antibiotics taken. She was born full term with no immediate complications. However, the newborn screening test was not done. There is there is a history of family allergies in the father, and they live in a well ventilated house, and the
No,
disease has
no need to mention. So simple. So there's family history of allergies, and the disease is impacting the child and the mother's psychological health as well. That's it. Okay.
okay. Yes.
Okay.
Yes, ma'am.
So, what is your impression? What is your
um
diagnosis?
so, so most likely the child is suffering from cystic fibrosis.
Okay. And what are your list of differentials?
um so First is cystic fibrosis, next is um a primary ciliary dyskinesia.
Very good. Hotel.
Also, there could be recurrent viral upper respiratory tract infections, and also primary immunodeficiency. Primary immunodeficiency is third, and then recurrent viral respiratory infections.
Okay. Okay. So, how will you manage this case, doctor?
So I will involve a multidisciplinary team involving the pediatrician, pulmonologist, dietitian, nutritionist, gastroenterologist, liaison with the schools, and provide psychosocial support to the parents. I would start by taking the by doing the complete examination for the uh, nasal polyps, clubbing, axillary and cervical lymph nodes, the palpating, auscultating and palpating the chest for looking in chest examination for evidence of uh, uh, chest deformity,
So you can
listening
mention
for
I will
any.
examine the child because this is she want to know about the management, right?
I will do a
Yes, I
detailed
will.
that is enough.
Yes,
Okay. So do a detailed
No
yes,
need to
ma'am.
examination.
tell your examination, no, because that you have to assess in your short
Okay.
clinical, no?
Yes, ma'am. I would take a detailed examination, and then I would investigate the child in the form of specific and supportive investigations. I would do the CBC to look for anemia, raise TLC count for acute infection, ESR for any chronic illness, CRP as well for acute infection, and then chest X-ray to look for any consolidation, pleural effusion, HRCT to look for bronchiectatic changes, sputum cultures, sputum swabs, sputum analysis for any bacterial colonization, and pulmonary function tests can be done. Also, I would like to do the confirmatory test in the form of sweat chloride test and CFTR genetic mutation analysis. For the GI complaints, I would do the stool elastase, fecal fat analysis, vitamin A, D, E, K levels, liver function test, and the abdominal ultrasound for cystic fibrosis related disease. Also, I can do the immunoglobulin profile and the tuberculin skin test. And then I would start with the management by involving the uh, uh, pulmonologist, the gastroenterologist.
No, a team comes first. Team, you already told. Don't repeat. From the first, you
Okay.
told the team,
Yes.
then the investigations. Anything
Yes.
else is there?
Yes, so I would, my goals of management would be improving the survival of the child, preserving the lung function, optimizing the growth and nutrition, and preventing the complications. I would focus on the airway clearance in the form of chest physiotherapy and nebulizations and postural drainage of the secretions. Also, I would give the oral and IV antibiotics as per the sputum cultures. And for the nutritional and gastrointestinal support, I would advise a high caloric, high protein diet after consultation with the dietitian, and would
Vanya, now you finish the respiratory first. So you said, what are you going to give for respiratory? First is physiotherapy. Okay,
yes,
then
nebulizations for
like
DNase alpha and hypertonic saline.
okay, and sometimes bronchodilators and steroids also can be given. Okay, what
Bronchodilators
else?
and steroids.
Okay, good. Excellent.
Antibiotics, oral and
Ex-
IV for the acute exacerbation.
Oral, IV, and inhalational as well. Okay, depending upon the.
Inhalation antibiotics. Yes.
Okay, okay, okay. Anything else?
Madam, chest physiotherapy and postural drainage to clear the secretions.
That you mentioned. Anything else apart from this?
Then I have the management for the GI symptoms.
Okay.
For that, after consultation with the dietitian, we would advise the high caloric, high protein diet. Also, after discussion with the gastroenterologist, the Creon capsules or the pancreatic enzyme replacement therapy could be started. Fat soluble vitamin supplementation in the form of vitamin A, D, E, K should be given. And then also, especially in a hot season, we can advise salt supplementation as well. And also, I would like to mention the screening for the diabetes and the cystic fibrosis related liver disease for the cholestasis. And then for further, I would offer the influenza and the pneumococcal additional vaccines, and good good precautionary measures to catch infection from the other patients. And then
Oh,
definitive is the gene transplant therapy, and
Okay,
this
you
we
have to
have the
stop.
ivacaftor modulator therapy, ivacaftor lumacaftor.